Lisa.
Hi.
Today we're going to go over glucose whole blood precision extra outpatient meter. This is for glucose testing. Have you read the procedure all the way?
Yes.
And you've taken your CBL in workday?
Absolutely.
Okay, great. So let's go ahead and take a look at the procedure, and we'll do our training. And then I'm going to have you do the sample on my finger and run the test. And I'm also going to show you about quality control and how to fill out that document.
Okay.
Great. So when we're looking at the procedure, we see the principle of this blood glucose test is when the blood sample is applied to the test strip, and the test strips are kept in this box. The glucose in the blood reacts with the chemicals on the test strip, producing a small electrical current. This current is measured, and then the result is displayed on the monitor. Any questions about that?
No.
Okay, good. So what we're going to look at here is the supplies. And so equipment and supplies are right here on the procedure, and you'll need an extra outpatient meter that is kept in this little black zipper. And this is what the meter looks like.
Okay.
And you'll need precision extra test strips, and that's what's here.
Okay.
And notice that the box is open, and it has an open date on it.
Okay.
There's also an expiration date that someone wrote here that should match this date here.
Okay, so
Okay.
it's actually the
Bottom one.
not when it was open doesn't have an effect. It's
Right.
when it was. Okay.
Right. So you have your open date and then your expiration date for your glucose test strips. And this right here is your lot number. The lot number is specific to this box, and then we will use that when we're writing on the patient log.
Okay.
The other item you need is a high and low level of control vials, and those are kept here. And you will run a level low and a level high every day that you run a patient. So if you only run one patient that day, you're only running your controls once.
Okay.
If you have 3 patients that day, you're only running your controls once.
Okay.
Okay?
Yeah.
Very good. You'll need an alcohol prep pad to clean fingers and a lancing device.
Okay.
So on this procedure, it talks about calibration. These little tiny devices do not require calibration. They do require quality control, and those are 2 separate things. And again, we talked about quality control. You'll run 2 levels each day you perform testing.
Okay.
In addition, quality control vials should be run whenever you need to troubleshoot the meter. So if there's something wrong with your meter, if it looks like it's damaged, you'll want to use a new meter. But if it's not giving you results that you think are accurate to the patient, you'll want to run QC again. That should be your first thing you go to.
Sure.
When the meter has been dropped, even if there isn't any visible damage, you should run QC. And a new lot number of test strips is open. So let's say you're working and you've ran QC that day, and you've ran 2 patients, but then you have to go into a new box because you ran out of test strips. With that new lot number of box, you'll have to do another round of quality control or QC.
Okay.
So we're going to talk about the procedure itself. You're going to want to remove the test strip from its foil package, and they come in these little foil packages. Each one is individually wrapped, and you'll see that it's scored here on this side. That is for easy opening for you. I'm a lefty, so I open them this way. Are you right-handed or left-handed? Right-handed. So you will open it this way. And when you open up the foil package, you're going to want to pull this way out. And you see those 3 black lines? That's what gets inserted into the glucose meter. You want to make sure you are not touching this portion of the strip, which is where the sample goes. So when you insert into the glucose meter the 3 black lines, the meter turns on. And you just want to make sure that your date and time is correct on the meter. And you can see the picture is showing you that you want to put blood on the test strip. And this is where you would clean the finger, poke with a lancet, get the first good drop. Don't wipe that drop away, you use the first drop for your glucose. So you'll put the blood drop on that spot, and within a few seconds you'll get a result. Are you good? Meter will turn off when you pull the strip out, and then you just throw the strip away in biohazard.
Okay.
So let's get started on doing quality control first. And then we will go to running my patient, and we'll talk about normal ranges and other things after that.
Okay.
Here is your quality control document. You can see that this serial number is for this instrument here. The serial number is right there.
Okay.
And you can see that we have our practice name written there. The test strip lot number is found on the box of test strips, so can you show me where that was at?
And that was down here.
And the expiration date written here is where? Good job. Okay, and so if you were to open up a new box and you'd have to run QC again, you would need a new sheet of paper because this information would change.
Okay, so every new lot gets a new...
Every new lot gets a new sheet, and you can see that that has been the case if you look here.
Now, if it's the same lot, let's say we got a box of the same lot, you would still start a new sheet because it was a new
No,
lot?
if it's the same lot,
Okay.
you are good with using
Alright,
the same
good.
quality control sheet.
Okay.
So the first thing I'm going to have you write is the date. Write today's date there.
Okay.
And we're going to talk about low control and high control. So your controls are in this box, but your control ranges are in the strip box.
Okay.
Okay? So pull the package insert out of the strip box. When we want to talk about the ranges and what our low values should be and what our high values should be, we're going to look all the way at the bottom here.
Okay.
And you can see that for the low quality control, we should have 31 to 61 milligrams per deciliter. That's our range for our low control. Our high control range is going to be 216 to 366 milligrams per deciliter. So what you're going to do here is get your bottles of quality control out because we need to write the lot number and expiration date of our QC. So if this is our first time opening the QC bottle, we have to know that we'll be putting a new expiration date once it's opened. It expires 90 days once it has been opened. So that then becomes your expiration date. You can see that somebody has opened this already and put a new expiration date on there. So what we're going to do here is put the lot number of the low level. This one. Yep. And the expiration date is the 90-day. Yes. This box will be for the result you get on the meter. This box is for the range that's displayed here.
About the lows, so
And make sure you put your units on the paper just like you're doing. So let's do this for the high control, the lot number of the high control. And the 90-day expiration date. And then your range. Okay. So you can go ahead and put the package insert back into your box. You will need 2 strips, one for the low QC and one for the high QC. Okay, so let's set up your table. Here's your meter. And put your low QC and your high QC in a place that you can identify them. Set your strips aside and put some gloves on so that we can get started. So in this procedure, it does talk step by step how to run quality control. And I'll go over that with you while you run your first control.
Okay.
So that's the low you're going to run. Remove the test strip from the packet. So it's perforated, just kind of pull them, yep.
And that's, this one is one I want.
Yeah, so when you take the strip, hold it like this, and pull up like that. So fold the foil back over it, and see if you can pull the other way. Just try to get the other side open. Okay, and make sure that the test strip isn't damaged, because we did kind of play around with it. Okay, that looks good. Take the end with the black stripes on it and insert it into the meter, and the meter should turn on. The lot number for the box of strips will display. Verify that this is the lot in use. Right up there for the box. Right there.
Yep.
Okay, great. The apply blood message will display on the meter. This tells you that the meter is ready for you to apply control to.
Okay.
Mark this test as a control by pressing on the middle button once. And a sideways control bottle will display on the screen. The middle button once. And so you see that little bottle that's right there. Mix the control. Just want to make sure that it's a well-mixed solution. Remove the cap. And apply a drop of control solution to the test strip at the end of the strip. Just like that. At the end of the strip. So let's just pull it. Just pull it with the nozzle. Yep, take it and pull it forward. There you go. Do not remove the test strip from the monitor or disturb it during its countdown. In 5 seconds you get a result.
46.
Okay, great. So now what we need to do is make sure that the 46 number we got falls between the range that you've written, and then go ahead and put that result there. To perform the next test, you just pull your strip out. Yes. And then we're going to run the high control.
Okay.
Just like we did before. So remove the test strip from the packet. That was a lot easier. Insert the strip with the 3 black lines. And the meter should turn on if you inserted it all the way. The lot number for the box of strips will be displayed. And this tells you to apply control. So now you want to press the middle button. And you see your sideway control? Very good. Now let's go ahead and run the high control. Right on the end. Very good. So you have your result, and you want to make sure it falls between the values of the ranges you found, and write that result there. Okay. This has to be done every day you run a patient.
Before you do the patient.
Before you do the patient, yes. So now the procedure for running a patient. Patient preparation. Capillary blood can be obtained from puncturing the fingertip using a disposable single-use lancet device. Alternate site testing is not approved by Bronson for this method. That means it always has to be on the finger. The puncture site should be cleaned and thoroughly dried before obtaining the blood sample. When testing is complete, dispose of the lancet in a sharps container. And only fresh whole blood capillary samples may be used. Do not use serum or plasma. That just means if you draw a tube of blood, it can't go through a centrifuge before you run any of this testing.
Okay.
So let's go ahead and have you sample my finger, obtain a free-flowing drop of blood, and use that first drop of blood. That's the things that you have to remember here.
Okay.
So let's go ahead and do that.
First I want to put my strip in.
Yes. So remove the test strip from its foil packet and insert 3 black line end. Confirm that the date and time displayed are correct and that your lot number is correct. So now instead of proceeding with QC, we're going to do a patient test.
Okay. In-house.
You do want to make sure that my finger is dry before you get your drop of blood. If the finger is wet in any way, it will dilute out your result and give you a false low result. Looks dry. So press and trigger. Very good. So pick your meter up. Good. Thank you. Okay. So what happened here is that there wasn't a big enough drop of blood. We didn't hear the meter beep.
Right.
And we can see that it's in the sample port area here, but it's still asking for more blood. Yeah.
Okay.
And so what we'll need to do is start the procedure over again.
Okay. Sorry.
Don't feel bad. This happens regularly when you're learning how to do these. Very good. And so the meter turns on, and now it's asking for blood. So you'll clean my finger off and get a new lancet. Okay, and make sure that it's dry before you will proceed. Okay, so apply pressure, straight up and down, trigger, and now squeeze for a good free-flowing drop of blood. You'll need to hear the beep. You've heard the beep that time.
Yes.
Very good. And now you have your result.
Okay.
So you need to document your result on your patient log. Here's where my name goes. And for today's purposes, we're going to use last name patient, first name training. And the date of birth will be 12/26/1971. And that would be patient's birthday.
Sure.
So the result you got on your meter?
114.
Very good. Today's date and time and your initials.
I need my computer for the time.
So we're going to talk about reporting results. Reference ranges. Reference ranges are normal ranges, what people normally run. So if a patient is fasting, they should be between 70 and 99. If they are non-fasting, their results should be 70 to 140. And our units are milligrams per deciliter. Expected values for newborns to 6 months are 40 to 150 milligrams per deciliter. Reference ranges are normal values. Reportable ranges is the range that you can actually report that number out.
Okay.
So the reportable range is any value between 20 and 500 milligrams per deciliter. Values below 20 will have a low or LO result on your meter.
Okay.
Values above 500 milligrams per deciliter will have a result of high HI on your meter. For glucose values that are below 20 or above 500, if a specific quantitative value is required, so they really want a number, then it has to go to main lab.
Okay.
We're going to talk about panic and critical values. Panic is a critical value, so an adult that has a glucose that's less than 40 or greater than 500, those are panic results, need to be communicated to the physician immediately. For children or babies 0 to 3 months old, the range changes from 25 to 200. So we're going to talk about cleaning the meter. It's acceptable to clean the meter with 10% bleach, 70% alcohol, or 10% ammonia. So for our purposes, you'll want to pull out this strip with gloves on. Yeah. So we'll dispose of our lancets, we'll dispose of our used test strip. The meter should be cleaned between each use. So you'll open a new 70% alcohol pad and just wipe down the surface of that meter. Both sides. And put it back in its case. When you clean the meter, you did a really good job. One of the things to keep in mind is that yellow port on the front where the strip goes. Just make sure you don't get any liquid in there.
I read that.
Okay. If you ever have problems with the meter and you don't believe the test result on your meter, always repeat your QC first. That is your first item to try to troubleshoot.
Okay.
If it needs a new battery, the batteries are put in the back, and you can just buy a new battery for it. If you have more problems with your meter, you can either call the technical support line that's offered in this manual, or you can call us at point of care.
Okay.
Do you have any more questions about running glucose testing?
Nothing I can think of.
Okay, then we're going to go ahead and fill out this form, and I will sign it and you will sign it.
Okay. Great.
Thank you.